What is Medicare Supplement Plan N? Hi, I'm Chris Westfall, the Senior Savings Network. I've been a licensed insurance agent for 24 years now, and I currently help seniors in 46 states across the United States with their Medicare Supplement Plan selection. Plan N is often a good choice, but sometimes not so good a choice. It depends on what you're looking for. What I really want to caution people on doing is finding simply the lowest monthly premium and then jumping on that, because there are some things that maybe some of the agents are not explaining to you. First, let me tell you about Plan F. That's the best plan out there. It's full coverage, pays for everything, but you pay more for it. Not only today, but in the rate increases that you'll see if you get Plan F. What we found is Plan F's rate increases often go up 3 times faster than other plans out there like Plan G and Plan N. Typically, we don't recommend Plan F because there is a better value when you accept part of the payment responsibility of Medicare, which is just paying the Part B deductible. Sometimes those savings are typically $300 to $500 per year merely by finding the best plan, and that's what we do. Any agent that tells you that one particular plan is going to be the best plan for everybody all across the United States simply does not have the experience to tell you what's best in your area per se, because it may be unique to your area. We just can't say one size fits all. So in this video, I want to tell you about Plan N and just find out if it may be something that you should consider. Some agents that I've found, as we talk to people all day from around the country, they've been told by an agent merely in a competitive situation that they can undercut the price that they've been given if they simply go with Plan N, sometimes not revealing all the details behind Plan N other than that very important monthly premium. So I thought it's important to tell you what you may not be hearing elsewhere, and that's this. On Plan N, it's similar to Plan G of the Medicare Supplement in that you have to meet first the Medicare Part B deductible. Now that amount changes every few years. As of the day of this recording, it's $183. That's the annual cost of Medicare for the Part B deductible. Now, if you had Plan F, it pays all that deductible for you, but you're paying way more than you need to in the monthly premium. So Plan F is usually out of the picture as far as the best plan for most people. Plan G is a really good fit. All you have to do there is you have to meet the Part B deductible. Again, as of 2017, that's $183. But by meeting that deductible and having some, as Congress calls it, some skin in the game, your monthly premiums are lower, and more importantly, your long-term rate increase trajectory, it's a fun word, of your rate increases year over year are better than had you chosen Plan F. So Plan G is a good fit for most people, I'd say. Plan N was introduced in 2010 as part of the Medicare Improvement Modernization, and Plan N gives you even more choice. But here's what you have to take into account. Plan N allows the doctor, the provider, to charge you up to a $20 copay for every single visit. So I want you to be clear on the fact that Medicare Supplement excess charges could be a factor, depending on if the providers that you go to do not accept Medicare reimbursement as payment in full. They call that accepting Medicare assignment. So if the doctor is not accepting Medicare assignment, which is everything that Medicare says I can have, and then your supplement's going to pay the other 20%. 80 Medicare percent, 20 Medicare supplement percent, I'm going to accept that as payment in full. If the doctor does not take assignment, and sometimes when you're in the ER or you're traveling and you have to visit somebody else, you don't really know if they accept assignment. Now, there are 9 states that have a law against excess charges, and those states have passed a bill called the Medicare Overcharge Measure. And in those states, no provider can charge you excess charges. So in those 9 states, Plan N may be even a better fit because all you're looking at is those series of co-payments without the looming mystery of what could the excess charge be on top of all my other co-payments. So I'll put those 9 states up here. If you're in one of those 9 states, then Plan N might be a good choice for you because, again, the mystery of what the excess charge could be does not affect you unless you're traveling. If you're traveling outside that area to California, Florida, whatever, and you have to go see a provider, they could, in fact, charge you excess charges. So let's dive in and see what the rate difference would be, what the savings potential could be in 2 distinct areas of the country. I'm going to look first at South Carolina, middle of America, and then we're going to look at 2 outlier places. One would be South Florida and California, because South Florida and California are very similar and what I'm about to show you. First, let's look at a normal state, and that would be South Carolina. Zip code 29466, a lady turning 65 years old, first time coming on to Medicare, and we look at all the companies that are out there, and one of the companies that comes up as lowest price today, now these rates will change, don't hold this video to it because things do change over time, but as of the day of this recording, the cheapest plan for her on Plan G would be $97.99. That's a good rate, much cheaper than other parts of the country. But on Plan N, it's less expensive. It's $82.84 per month. A monthly savings of $15.15 if she goes on Plan N over Plan G. Remember again, the difference is on Plan N, she's still going to have to meet that Part B deductible just like G. But now she's subject to $20 co-payments every time she goes to the doctor. So the initial savings right off the bat on Plan N in South Carolina on this particular case would be $181.80. So if she goes to the doctor 5 times a year, and by the way, there's a Chicago Tribune study that shows that people over 65 on average will go to the doctor, either primary or specialist, 7.4 times per year. So 7 times a year is what the average is. Some people managing chronic illnesses go a lot more frequently. Some people who are very healthy only go maybe once or twice a year, but the average for over 65 is 7.4 visits to the doctor a year. So if a person goes to the doctor 7.4 times a year, that's $40 a year she would end up saving after paying if she paid a $20 copay for each visit. She'd save $40 a year, or $3.40 saved per month after an average, going to the doctor 7.4 times. So she'd save $3.40 per month, but remember, she's responsible for any and all excess charges. So if she visits any specialist, it would typically be a specialist that does not accept full Medicare reimbursement. She'd be responsible for 15%, up to 15% of every one of those bills too. So some people tell me that for $3 in savings per month on a typical person that goes to the doctor a regular amount of time and being exposed to the potential of excess charges is not worth it. It's not worth saving $3 per month when all those things are factored in. So Plan G has no limitation on going to the provider, any doctor that you want to. You can go as many times as you want with no co-payments, no more out-of-pocket costs, and you're not subject to excess charges no matter where you go. That's why Plan G would be my recommendation for this lady in South Carolina. Let's look at one of the outlier places though. I talked about South Florida and most of California and why Plan N may be a really good choice for you if you're in South Florida. So we're looking at zip code 33130 in Miami, and this is very true also for the 90210 Beverly Hills or 90014, all the Los Angeles zip codes way out in California. And again, it depends on where you are. That's why we do custom quotes depending on where you are for what plan, and we'll compare those for you. It's a very highly personalized field that we're in. But just to give you an example, in South Florida, the cheapest Plan G, get this, is $253.34 per month for a person turning 65. That is super high cost in South Florida for the same Medicare supplement you can get in South Carolina for $97 a month. But on Plan N, the monthly cost, same company who we're comparing apples to apples, the Plan N cost there is $223.53 per month for a total savings of $29.81 per month. So right off the bat, you would save $357 in your first year by going on Plan N instead of Plan G. So if you go to the doctor's office 7 times per year, again, that's the average, is what they say, you would still save $217 a year in South Florida on Plan N with this particular scenario. So that's $18 a month you would still save even after going to the doctor the average amount of times, 7 times per year. And again, those numbers are very similar for California. What does that mean? It means that every location is different. And that's why we run a quote based on today's prices or when you're going to get onto Medicare. We run a quote based on your area, looking at all the different companies that are available, and we'll look at Plan F, Plan G, or Plan N, see which one makes the most sense for you. In most of the cases, in my experience, over thousands of people in 46 states, it's been Plan G has been far and away the best value. But we want you to have those choices. If you don't understand anything of what I said about Plan F, Plan G, co-pays, out-of-pocket excess charges, we'll be happy to explain that to you if you give us a call. It makes it very simple when we just break it down, give you the bottom line numbers, ask you how many times do you think you'll be going to the doctor, how healthy have you been in life, or are you having any chronic conditions that you have to manage. Medicare healthcare is very personal, and it's different for every single person. That's why we don't have a massive call center that just stamps out plans and says, you need to take this particular plan, because it's deeply personal. It's very different based on what you want to deal with. We have seniors call in all the time that say, I don't want to deal with deductibles. I don't want to deal with co-payments. I don't want to deal with any of it. Give me the simplest plan in my area. And because we're an independent agency with representing multiple plans, not just one company like some agents do, we represent multiple companies, so we can tell you not only which plan is best, but which carrier is best. And the easiest part about it, the application process takes about 5 or 10 minutes. And it's all done over the phone. We don't have to come into your house and wipe our feet off and help you drink some coffee or lemonade. No, it's done right over the phone where you don't even have to lift a finger just to help walk through the application process. It's all very safe and secure. So if we can help you look at plans that are specific for you and your area, whether you're new to Medicare or you've been on Medicare for a long time, it definitely pays to shop the marketplace and get a second opinion. My name is Chris Westfall of the Senior Savings Network. Thanks for watching. And if you found value in this video, please like and subscribe to this channel, like the little video that's down there, and subscribe to new updates happening with Medicare. As you probably know, things change with Medicare all the time. I've got over 4,000 agents that subscribe to my training site called Medicare Agent Training, where we educate them on what's happening in the industry, and thousands of Medicare clients that rely on us for updates on what's happening with Medicare. So make sure you're a part of that so you don't miss anything. Thanks for watching today. God bless you, and we'll talk to you soon. Bye-bye.
Be dancing, and she's beautiful. Again, Angela was lucky here because she got the rehabilitation, and the insurance company said she won't be billed for it. But Jamaica Hospital says it still hasn't been paid by Oxford and doesn't think it will be. In fact, the hospital's parent company is suing Oxford in federal court over issues just like this one. And Kate, you know, we talked to a lot of experts who say patients aren't as lucky as Angela very often, that they get turned away by the hospital, and that this is something people have to think about.
Let's point out what the difference is in Angela's case. That letterhead from ABC News.
Maybe. This hospital, to be frank, Jamaica Hospital is lobbying very actively on her behalf. But
so it could be partly that, too.
It could. But we like to get involved in these things because you see someone like Angela, and it takes your heart, and it hurts it because
but
you
wonder how many other patients out there could use a letter from someone like you to go after the system.
That's exactly right. And that's why we do the stories, because the more people know about it, the more we pay attention, the more people there are to help people like Angela. It's time now.